when I'm thinking about chronic health conditions, and we've been talking a little bit about what a chronic disease is and your own personal experiences, I can imagine our listeners sitting out there and thinking, well, it's probably just a small amount of the population that you're dealing with. And I, reading out on your website, saw that there's some 42,000 children in the state of New Hampshire alone that are dealing with chronic health conditions, and of that amount, 10,000 of them are life-threatening. I was amazed, really just astounded. I had no idea the scope of what you're dealing with here.
It is a much larger population than people would anticipate. It actually comes down to 1 in 6 children contend with a chronic health condition. So if you think of that, I mean, that's basically either yourself or your neighbor has a child that is dealing with a chronic health condition. As far as for adults, it's 2 out of every 5 adults as well. So when you add all of those numbers together, you're talking about nearly 500,000 New Hampshire citizens are dealing with chronic disease. So to say that it shouldn't be, you know, a centerpiece for our policymakers and something that we should be addressing is very naive. One of the, you know, and unfortunately these numbers are on the rise, and so that is the goal of the partnership, the Partnership to Fight Chronic Disease that we have partnered with, and we're a national organization to bring about awareness and ways that we can prevent chronic disease from happening and developing, and if you do have a chronic disease, how you can manage it, and through proper screening and testing and medications.
Yeah, you mentioned the Partnership to Fight Chronic Disease, and I know that you work in collaboration with them. And I did kind of go out to their website as well and get a little information that I'd like to share with our listeners. They have indicated that 75% of the $2 trillion, I can't get my head around that number, $2 trillion in healthcare costs that are spent annually are on chronic diseases. And that amazes me.
It amazes you, but if you really sit down and think about that, I think you could easily understand how that number becomes as large as it does. I mean, many times if you do have a child with a chronic health condition, and we're speaking about the medical expenses, we're talking about the medications, the special foods that child might require, transportation back and forth to the doctor's office, the fees that are associated with going to the doctors. And it adds up. I mean, many times, then if a child has, for example, a diagnosis of cancer, a parent has to stop working. And now, in today's society, most families have 2 parents that are working, so that's an income that now is cut in half for that family. And if the family is now half the mom is down in Boston taking care of that sick child, sometimes they need to hire additional help if there's other siblings at home to help the household at home stay up and running. Sometimes you don't always have the support of grandparents or friends and neighbors to step in. I mean, we were fortunate that we did have parents that were able, my parents and my in-laws were phenomenal. I had friends that were there to assist us. But even still, the financial impact that it has can be devastating to a family.